Good afternoon. The incidence of breast cancer is increasing in India by about 1 to 2% per year, and a lot of women, especially in the middle-aged and older age, are coming to us with early diagnosis of breast cancer. The additional reason is that the awareness is increasing, therefore women are going for tests on their own, and therefore more number of women are being diagnosed with breast cancer. Now, the breast cancer can present in many stages. If it presents in early stage, the outcomes are very good, and the various modes of treatment that are used are surgery, chemotherapy or hormonal treatment, and radiation. Now, which modality is to be used depends on the type of breast cancer, the age of the patient, and the nature of the breast cancer, which is determined by doing the tests. So the first step is to confirm the diagnosis of breast cancer by taking a biopsy. The results of the biopsy come in 3 to 4 days' time. Then we sit with the patient and counsel the patient about the options available. And if it is early breast cancer, what we do is to remove the local lesion and save the breast so that the functions of the breast continue, and this is followed by radiation. Chemotherapy is given to about 70% of cases of breast cancer. The other patients benefit from hormonal treatment. So especially younger patients do require chemotherapy, and chemotherapy reduces the risk of breast cancer by about 30 to 40%. It doesn't make it zero. What I am trying to say is that even with chemotherapy, the breast cancer recurrence can occur. But the recurrence of the breast cancer is reduced by 30 to 40% if we give chemotherapy. The chemotherapy is generally given for about 4 months, and various drugs are used. Generally 3 to 4 drugs are used in sequence or together. And at the end of chemotherapy, we give radiation. Now, those people or those women whose breast cancer expresses what is called as estrogen receptor, then they are put on what is called as hormonal treatment. These are tablets which these people or these patients have to take for many years, generally exceeding 5 years, sometimes 10 years. The outcome of breast cancer has changed dramatically in the last 20 years. First, because of the discovery of more and more drugs, discovery of biological agents, and most important is the early diagnosis of breast cancer. As I said, the results of early diagnosis are better. Therefore, the emphasis should be on, number one, screening the patients and diagnosing the patients at early stage. Now, how do you diagnose patients at early stage? Is by increasing the awareness. The biggest age group of risk of breast cancer is between 50 and 70 years. I'm not saying that it doesn't occur below 50, it does occur, but it is uncommon. So people or women who are in the age group of 50 to 70 years are at the highest risk of breast cancer, and therefore these are the women who should either regularly visit a physician for breast examination or do the breast examination themselves or undergo a mammography. The advantage of all these things is that it doesn't prevent breast cancer, but it enables us to detect breast cancer in a very early stage, and therefore the outcomes and the survival results are much better with early diagnosis of breast cancer. I think apart from all the discoveries, the most important thing that has an impact on the outcome of breast cancer is what is called as downstaging of breast cancer. In India, the awareness is still very low, therefore we get most of the patients who present in stage 3 or stage 4, and therefore their outcome is bad and the treatment is also quite prolonged. So I urge all of you that if you are in the age group of 50 to 70, please go to a physician or get the breast examination done or do self-examination of breast regularly, and as soon as you feel that there is a lump or there is anything suspicious, report to the doctor who will investigate the matter. With all this, I wish you well and hope that you will contribute to the awareness and improved survival of breast cancer in India.